biggest question that we receive is who is going to get vaccinated first, then next, when am I next? And so we want to provide you with some follow-up information on that from the CDC, infused with the Iowa Department of Public Health. So because the supply of COVID-19 vaccine in the United States is expected and is limited in this first go-around, the CDC is providing recommendations at federal, state, and local governments levels about who should be vaccinated first. The CDC's recommendations are based on recommendations from their advisory committee on immunization practices, which is an independent panel of medical and public health experts. Those recommendations come to our state level, the Iowa Department of Public Health, who takes their recommendations from the Infectious Disease Advisory Council, a council that they have appointed at the state level with many subject matter experts, who then creates additional recommendations and expectations and guidance for our local level public health departments. The recommendations were made with these goals in mind: decrease death and serious disease as much as possible, preserve functioning of society, and reduce the extra burden of COVID-19 is having on people already facing disparities. The CDC recommends that initial supplies of COVID-19 vaccine be allocated to healthcare personnel in long-term care facility residents. So this is referred to as Phase 1A or Tier 1A. The state of Iowa also supports that recommendation. We are required through a vaccine shortage order through the Iowa Department of Public Health, our state, that we can only continue to vaccinate Phase 1A in our county, and we have to wait to move on to any other phases until the entire state has gotten through Phase 1. This is to create equity across the state, and so we can get those vaccines out and moving and on to our next Tier 1B as an entire state. It is a lot to orchestrate at local levels and at the state level. Groups who will be offered the vaccination next, according to the recommendations of the CDC. So please know that this may change at any time if the CDC advisory committees make any changes, if the Infectious Disease Advisory Council for the Iowa Department of Public Health makes any recommendation changes, which we know to happen and happened with our Phase 1A for the state of Iowa. Phase 1B includes frontline essential workers, also known as critical workforce. So the examples given by the CDC at this time, subject to change for the state of Iowa, is this workforce would be firefighters, police officers, correction officers, food and agriculture workers, United States postal workers, manufacturing workers, grocery store employees, public transit workers, and those who work in the educational sector. And part of 1B are people aged 75 years and older, because they are at highest risk of hospitalization, illness, and death from COVID-19. So as you can imagine, that's a lot of folks in our county, across our state, across the U.S. So this is going to take time, planning, and partnership to make happen for Muscatine County. Then Phase 1C will come after that, once Phase 1B is completed across the entire state. Phase 1C includes people aged 65 to 74 years, because they are at high risk of hospitalization, illness, and death also from COVID-19. People aged 16 to 64 years with underlying medical conditions, and also other essential workers. This could be people who work in transportation, other logistics, food services, housing construction, finance, information technology, communications, and so on. So as vaccine availability increases, vaccination recommendations will expand to include more groups. And we are committed to continuing to communicate those groups with you. We have pharmacies and volunteers throughout our communities, throughout our county that are ready and willing to help us with these vaccinations. We have partnerships so we can go out into different pockets of our county, into communities, and offer these vaccines for the general public. So please know, as we learn more information, we will most definitely share that with you. Watch our Facebook page, Trinity Muscatine Public Health. Also Instagram, Trinity Muscatine Public Health. And if you go to the Muscatine County website, they have a great little spot at the top of their website that says COVID-19 updates, and we will be posting updates for the general public in that location. We also are committed to our media partners are wonderful to work with, and we're sending them all of our updates so they can get it in print for individuals throughout Muscatine County. We are committed to you. We care about you. You are all a priority to us. Thank you so much, Muscatine County, for your patience, your grace, your understanding as we move through this very challenging mass vaccine distribution process. Doing it together and collaboratively is going to get us to the end result we all want. Thank you so much for your time.